I'd like to call the Health and Human Services Meeting Committee to order. Madam Clerk, please call the roll.
Alderwoman Green. Alderman Gunther.
Here.
Alderwoman Martin. Alderwoman Middlebrook.
Present.
Alderwoman Rice.
Present.
Alderman Todd.
Present.
Chairwoman Ingracia.
Present.
5 present, you have quorum.
Thanks so much. The first item up for business is approval of the minutes from our February 28th, 2022 meeting. You should have a copy of those on your Google Drive, and I would entertain a motion to approve those.
I'll move that we approve the minutes from February 28th, 2022.
Second.
Madam Clerk, please call the roll.
Alderwoman Green. Alderman Gunther.
Aye.
Alderwoman Martin. Alderwoman Middlebrook.
Aye.
Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairwoman Ingracia.
Aye.
5 aye votes.
By your vote, you have approved the minutes from our February 28th, 2022 meeting. We don't have any board bills or resolutions for review, so we'll move to committee discussion. We have members from AT Still's Dental Center, which is located just east of Lafayette Square here, who reached out to me, and I'm excited to have them present to learn more about what they did with their grant from the St. Louis City Senior Fund for Oral Care for Older Adults program. So I believe you all, did you have a presentation that you wanted to? Okay, so I'll let you all handle who wants to go when, and if it's okay with you, I'll just swear you in quickly. If you could just let me know your name and then your role at the university, and then you'll be able to present whenever it's your portion. And at the end of the presentation, we'll go ahead and do a Q&A with members. Does that sound okay?
Yeah, that sounds fine. I'll be introducing the group, but I'll go first here. Patty Inks, I'm Director of Dentistry in the Community and Integrated Community Service Partnerships.
Okay, Patty, do you affirm that the testimony you're about to give will be the truth and nothing but the truth?
I do.
Thank you.
Joan Davis, Assistant Dean for Research at AT Still University, Missouri School of Dentistry and Oral Health.
Thank you, Joan. Do you affirm that the testimony you're about to give will be the whole truth and nothing but the truth?
Yes.
Thank you.
Jane Clark, Patient Care Program Manager, AT Still University, Missouri School of Dentistry and Public Health. Oral Health, sorry.
No worries. Thank you. Do you affirm that the testimony you're about to give will be the whole truth and nothing but the truth?
I do.
Thanks so much.
And I'm Lori Crawford. And you.
I'm Lori Crawford, and I am the Dental Hygiene Outreach Coordinator at AT Still University at the Dental Clinic.
Okay, excellent. Do you affirm that the testimony you're about to give will be the whole truth and nothing but the truth?
I do.
Okay, feel free to share the screen and move on from here.
Okay. Thank you very much for having us here. We are from AT Still University. We already did the introductions there. So I'm Patty Inks, Dr. Joan Davis, Jane Clark, who is from Ward 15, and Lori Crawford, who's from Ward 13. So AT Still University, first and whole person healthcare, founding School of Osteopathic Medicine in 1892. So the Missouri School of Dentistry and Oral Health came into being in about 2012. We graduated our first class in 2017. And it's always been very important in the mission of the university to provide care for people who are struggling to find the care that they need. So a little history for us and how we came to be and some of the partnerships that we've formed over the years is that when they first started the Coalition for Oral Health and the Missouri Primary Care Association came to AT Still University and said, you know, we really need another dental school. And St. Louis was really suffering after WashU and St. Louis University closed their schools. And so as the possibility of a dental school was happening, Kirksville community raised over $1 million to support the dental school. And they really wanted us to put the dental school in Kirksville. And then the Missouri Foundation for Health supported us. And then as it came to be that we were going to have this split campus where our students would do their first 2 years in Kirksville, Missouri, and then transfer down to St. Louis, the clinic here for the last 2 years, we formed a partnership with Affinia Healthcare. And so the building itself is owned by A.T. Still University. The education happening in the 92-chair clinic is Missouri School of Dentistry and Oral Health, and the operations and everything that happens in the operations is Affinia Healthcare. So through these partnerships we got here, and we've always been very involved in wanting to get out into the community and do outreach. And so back in 2016, I was working with some dental students who went into an independent living center. And we talked about how they could come to the dental school and that we had these reduced rates. And I really kind of got smacked in the face by a person who came back to me and said, well, how much will it cost me? And I said, well, you can get an exam and x-rays and all this stuff done for $110, and it would cost you $300 on the outside. And the woman kindly looked at me and said, honey, I have $5 left at the end of the month. So that put me on a search to say, how can we help some of these older adults who really need some dental work done? So I was fortunate enough, we got some funding from the Retirement Research Foundation for Aging, the Wrigley Company Foundation, Oral Health America, and then lucky for us, a year and a half ago, we got 3 years of funding from the St. Louis City Senior Fund to provide direct services to older adults. So our program, these are the program requirements. St. Louis City resident, age 60 or older, at 200% or below the federal poverty income levels. Now, what we ask them that they are living independently, and one of the reasons for this is because we are a dental school, and we have students who are learning to be dentists, and we have a lot of complicating factors and long appointment times, and so people who are in assisted living areas, we're really not quite the right format for them to have dental care done. We ask them to attend a one-time 1-hour class. And again, the care is provided by the student dentist under the supervision of faculty dentists. And really what we want to do is restore function and provide maintenance care. We want to restore that function so that people can be eating right, have the proper nutrition, and actually to feel good about themselves as well. Now, because we have them attend this 1-hour class, it's an education program, and Lori is the one who presents the education courses. So I'm going to let her tell you a little bit about what that looks like. Lori, I'm not hearing you.
Okay, I know I was muted because and I'm unmute. Thank you, Patty. I appreciate it. Yes, part of I think one of the big successes here is because we have the education program. One thing that we do is they go over like a grant agreement that they kind of sign, and that gives them the information of what to expect during their time as a patient here. And one thing is the time commitment. It is a little bit longer than most because we're in the dental school. We also let them know and educate them on the student. They'll have a student dentist under close faculty supervision doing the work, so they understand that when they're coming into the program. We assess their income and insurance there. We also give them a dental and oral cancer screening, which is really interesting because we have found several suspicious lesions that we were able to bring in our oral pathologist that day and work out to get them a biopsy. And then we have the dental education and the oral hygiene part. Patty, you want to do the next slide? So it's interesting when we start with the education program, we try to dispel some of the myths with dental. A lot of the patients have never been to a dentist or don't have the dental education behind them. One of the myths that really surprised most of us is like eyesight and hearing. We kind of lose that as we age, but most are surprised to find out that tooth loss is not a part of aging. That's kind of a real light bulb moment. They're just assuming because they're aging, they're going to lose their teeth, Or you hear a lot, my parents had bad teeth, so I will too, and I will lose my teeth. So we kind of let them know that's not true. We ask them what they think is important, why they need teeth as we age. And many of them say, you know, healthy eating habits. We have to be able to eat and chew. A lot of it's they want to smile and be social. They want to have a nice smile. We informed them about the oral systemic link. Many are really surprised to find out that poor oral health can lead to, or has been connected to oral heart disease and stroke, diabetes, and even lung issues. We do touch on some nutrition, and of course we need teeth for good nutrition, and teach them about healthy food choices, show them about hidden sugars, how to read labels. And we get this information from the myplate.gov for life stages for older adults, which actually puts the food on a plate and explains easier how they can have a healthier diet. We go into how decay and periodontal disease or gum disease, what are the causes are and what are the progression and what can they expect. They understand it more when the student dentist is saying you have gum disease and what is going to be done to combat that. And of course, we go over home care, just simple toothbrushing and flossing, how to take care of their dentures and their partials, and what to expect on continuing care. Many people with dentures didn't realize that they can still come back here and should be seen once a year and have an oral cancer screening and make sure their dentures are fitting. And I believe with this education, it's contributed to the success of the program because they go in understanding more what is going to be done and why. So, Patty, thank you.
Yeah, so an idea, thanks, Lori. And you know what, it's a great program and they really enjoy it. And it's funny because our dental students will sit in and help with the class and, you know, they learn something all the time too. So it's really a great program for everybody involved. We do provide a wide range of services, and this is not a comprehensive list here, but this is probably the most common services that we're providing. And again, as I said earlier, we really want to improve their function and ability to eat healthy food and improve their perceived quality of life. And, you know, by giving them a nice set of teeth or healthier teeth, it can improve their overall health.
Patty, you're muted.
I can hear.
Okay, I'm not muted. Hopefully, can you hear me now?
Yes, we can hear you.
Okay, great. So this is just two examples of dental treatment that we have completed as part of the program. And UCR prices, that's what the usual and customary fees would total out in private practices in the area. And so, you know, on the top line, you can see a more extensive treatment where we had to extract several teeth. We did a biopsy, which turned out to be negative. Thank you. That was good to know. Complete upper denture, a lower partial, exam, cleaning, and transportation for the total treatment costs there through the school was under half of what it would be out usual and customary in the community. And then on the bottom picture there, there's somebody who had less work that needed to be done, thankfully. But again, the total treatment cost at $1,895 versus around $5,000 out in with the community private dentist. I'm going to let Jane tell you a little bit about who our community participants are.
Thank you, Patty. I had to turn off my speaker so Lori didn't get feedback. As a program manager, my job is day-to-day operations. I will share with you our numbers to date, the partnerships we have formed, and the need for transportation assistance. We are excited to announce that we've had 310 individuals attend the SmileWise class. In the city map on the right, you can see we serve participants from all city zip codes. Of the 310 class participants, 259 have received at least a comprehensive exam and x-rays. The rest are either scheduled or will be contacted in the next couple of weeks. Our goal was to keep our average treatment plan below $2,000, which we are doing well. As a side note, the average annual income for our patients is about $13,239 per year. This means the average treatment for our patients would be 9% of their annual income. Most of our patients would not have dental care without the ACOA grant. This funding is essential for their health and well-being. Now, it may seem odd that some treatment plans have no associated costs for ACOA. In these 24 instances, insurance covered 100% of the treatment. This has helped to offset more expensive treatment plans. These include osseous surgery for periodontal disease and removing benign bony growths in the way of planned dentures. Even with expensive cases, we are always thrilled when we can restore oral health for our patients and not just pull teeth. However, 65% of our patients need at least one partial or full denture, and half of those require full upper and lower dentures. Next slide, please. Our partners are essential for the success of ACOA. Partners provide referrals, assist with dissemination and marketing, and serve on our community advisory board. The University of Health Sciences pharmacy students have provided information to class participants about the effects that their medications have on their oral health. Referrals from partners account for 38% of our referrals, even larger than from word of mouth and in-house referrals. Next slide, please. The need for transportation assistance has been significantly greater than expected. Lori and I are not case managers, yet we spend a significant time providing case management assistance for our participants. We first partnered with Yellow Cab, but we couldn't rely on them to provide rides for patients in certain zip codes. With a third of our participants on Medicaid, we hoped that would relieve the burden. However, Medicaid will not provide transportation for services it does not cover, including educational classes, crowns, or dentures. Medicaid's automated phone line also requires a certain level of oral clarity and technical savvy, and we have had to assist some patients with getting these rides. The St. Louis Area Agency on Aging's transportation with Lyft is another option we promote, but they are not available to provide rides for 8:00 a.m. appointments, and sometimes the hold times are very long. That's when we obtained our own Lyft account. From a management perspective, Lyft is less time consuming, but the cost is about the same as for taxi cabs, especially with the rise in gas prices. We continue to work all angles to assist with transportation. Joan will now talk about the work we are doing to share our experience with others. Joan?
Thank you, Jane. In the few minutes we have left, it's important for St. Louis and for the St. Louis Dental Center, MOSDO, our dental school, and Affinia Healthcare to think in terms of this project, this private and public partnership that we have with Affinia, with the city, creates actually a very unique model to provide care for the underserved and to address the numerous barriers to care. And a part of what we want to do with the ACOA project is to understand in a ongoing way how we're actually meeting the needs of the patients that we see. So we use several different quality of life surveys that we conduct at the beginning, middle, and we follow all the way through their care. And it's great feedback. And then we plan on presenting the unique partnerships and the outcomes of this, of providing dental care for our patients in different professional journals, abstracts, and presentations. So we're very excited about letting the world know that we really have a unique partnership, and truly without the funds from St. Louis City Senior Fund, we couldn't possibly do this. It just would not be possible. But so we wanted to, this is not a research project, but we definitely keep metrics so that we know how we're doing. If we could go to the next slide. So what we're wanting to do for the remainder of the 3-year grant and beyond is to continue. We could not possibly provide the care for these hundreds of older adults without the direct care funding. And it's just become an essential part of the project, or it is the project. In order to fund the program manager's position, we need those, we are dependent on the funds. So we would just like to share with the aldermen the value to older adults in St. Louis. And we've been able to help hundreds, and we hope to help several thousand more. So we just are sharing with you that we've created the infrastructure, we've created the capacity, and we are ready to continue this service on beyond the June 2023 ending of this 3-year cycle. So I think at this point in time, we'd like to open it up to you for questions. Thank you.
It looks like we might have lost Alderwoman Gracia.
I'm sorry, Alderwoman Ingracia had to step out for a minute.
Okay.
So I am going to take over. And what I am going to do is see if we have any questions from anyone on the board here. I'm sorry, let me pull up my notes. 1 second. Okay, so we will, of course, I can't pull up notes. Okay, so we will start off with Alderwoman Green. Is she here? Do you have any questions? Okay, Alderman Gunther.
Thanks, Madam Vice Chair. Not really a whole lot of questions. I want to say hello to AT Still. I am have been a customer of, or I guess a client of AT Still, and wonderful professional services. My student dentist graduated last fall and has now started her own practice up in Minnesota, but it was a great experience, and everyone was very, very kind there. So thank you, AT Still, for your work. I have talked with Lori about this a couple times when we ran into each other in South City. And I know that at one time I had received some flyers that I was able to take to some of my senior homes. I have, I think, about 6 senior homes. And so I was wondering if you still have more flyers available for kind of the new, since we have a new, I guess, 2023 period of outreach, that maybe we can get to the Board of Aldermen so that we can get these out to our constituents. And I guess that would probably be something I have on our drive. I have kind of a presentation, but it doesn't really look like anything that I can print. So if there's anything you could send us that we could print, that would be great. And then the other question I had, kind of that first slide, you had a number, or first or second slide, it looked like there was a couple different funding opportunities that kind of came and went. And so now we're on a funding opportunity, a new funding opportunity through 2023. Is this something that kind of every 3 years, or as one grant expires, you have to go look for a whole nother organization? Or is there any continuity with some of the funders so that you guys can keep this going long-term and not just 3-year periods? So that would be my only question.
So great question, and we learn as we go. Direct funding for direct services is very difficult to find. The first 3 that we had, 2 of the 3 were more for the education and the that type of thing, and then we got 1 year of direct funding from the MMF. We are looking at going back to them for more funding when we've been focusing on getting our everything in place with the city fund, because that's been a big one with bringing in that many people over a period of 1.5 years. But it is a continuum to try to go back and get more funding So yeah, we do have to always be looking, Dan.
Okay.
And I'll just add that with the St. Louis City Senior Fund being a tax levy funding source, we are hopeful that you as aldermen and then others within the city would see the great return on their investment. You'd be hard pressed to get better for dental care. And so we hope to write another 3-year grant and continue without interruption funding either at the level so we can continue doing what we're doing. And we have approached St. Louis City Senior Fund on the our hope to continue. But we don't have a lot of options, as Patty has said, but the unique funding source that St. Louis has offered its older adults is really outstanding. And again, I hope to really get that out there as a unique model.
Okay, wonderful. Thank you. And thanks again for all the work you do.
Thank you. And I might just add, we sent you an infographic about the first sheet is an overview of the ACOA project, and then the backside is the state of Medicare coverage of dental care for older adults, just to give you an idea of the difficulties. So that also may be helpful as kind of a general information sheet.
All right, I have that up in front of me right now. So thank you.
Thank you.
Thank you. Alderwoman Martin. Alderwoman Rice.
Thank you so much. Thank you so much to all of you for being here. And number one, I just wanted to say your workplace looks like it would be a lot of fun. It looks like you all work really well together. So it's great to have you all on here. And your ability to coordinate the muting and unmuting so we aren't getting feedback is phenomenal. Thank you for mastering that technique. I do have a question about the map that you put up. So the map that showed where patients were coming from. The legend just kind of gave zip codes and things, and so I wasn't able to tell what the colors coordinated on the map were showing. Was it like a density of patients that were coming from certain areas or not? And I'm wondering if you wouldn't mind maybe just popping the screen share back on and pulling up that slide so we could just talk about that map. I think that'd be helpful.
Sure, Patty, if you get that, I'll go ahead and talk to it.
Wonderful.
There we go.
Yes.
The map shows, and you are correct, it is the density of participants. One of the last presentations that was done by Lori before we shut down because of COVID was over at Hilton Point 1 Apartments in 63112. And the interest in our grant and the services provided by ACOA just grew exponentially. So our largest concentration of participants is from 63112, and it's about 20% of our participants. After that,
so the darker red is the
right.
more, and then the lighter red. Okay.
Yep. So there's about 40 from there, and then between 20 and 30 from all of the reds. That includes 63147, 10, 3, 4, 18, and 11. The light orange is from 10 to 20, and that includes 16, 8, 13, 15, 7, and 6. And then from 1 up until to 9 is 63109, 63129, and zip codes 1 and 2. This also gives us a great idea of where our outreach needs to continue. And that is something we look to do as we continue to open up after the COVID pandemic.
Okay, great. Thank you. That's really helpful to kind of walk through where exactly it is that the patients are coming from. I am sure that there's a great need. When I have gone in for my, for my checkups and things, that my hygienist has talked about just the lack of dentist availability that we have here in this city. So let alone cost effective or free services for people who can't afford it otherwise. I can't speak to our healthcare industry and why our face bones aren't treated like the rest of our bones, or face tissues aren't treated like the rest. But it's clear that the need is really important. So thank you so much for your work and for the presentation. And maybe if we could get the presentation emailed to Alderwoman Ingracia after the meeting, and then we can all have it for our reference going forward. Thank you.
Alderwoman Rice, I was actually going to ask the same
we could
question.
stop
if we could
share.
get that email. Yeah. I was going to ask if we could get that emailed to Alderwoman Ingracia. That would be great, especially since she had to step out. I actually just have a quick comment. Thank you for being here. And the presentation was great. And I do understand, because I do work with elders, they don't take their oral health as important as the rest of their health experiences. And it is so very important. And I try to talk to my seniors regarding the fact that your oral health is correlated to your heart health. So, it's really important to go to the dentist, and a lot of them are afraid. So, I think that this information that we received is really, really great. Also, the presentation was awesome again. I'm sorry, I skipped over Alderman Todd. Is he here?
Yes, I'm here.
I'm sorry, do you have any questions?
I don't have any questions. I would just like to thank the guests for coming and sharing the information. I learned a lot, and I can share it with my constituents. Thank you very much.
Thank you. Okay, so Alderwoman Ingracia is not back yet. So I will ask if we have anyone with any announcements from the committee. Okay, hearing none, we will move on. I have been informed that our aldermen and alderwomen that are not here have been excused. And next we are going to go to, can I get a motion for adjournment?
So moved.
Second.
Thank you. We will go ahead and adjourn our Health and Human Service Committee meeting. Everyone have a great evening. Be safe.
Thank you so
Thank you.
much.
You all.
Thank
so
you.
much.